is now 7:36. Thanks so much for joining us here on Good Day Gulf Coast on this Monday. So September is Suicide Prevention Awareness Month. It's a time dedicated to breaking the silence and reducing the stigma around mental health. Suicide is one of the leading causes of death in the United States, but experts say it's also preventable when people know how to recognize the signs and where to turn for help. We know it can be a very difficult topic to talk about, but it's so important. So joining me this morning is Hannah Majure, with a therapist with AltaPointe. Thank you so much for being here.
Absolutely. Thank you so much for having me.
And Hannah works in the schools too, so directly with children. Okay, first things first, why is it important to be talking about this, to make September a month for this? Why is this important?
It's important because, like you said, this is our Suicide Prevention and Awareness Month, and suicide does not often get talked about because it can be uncomfortable to talk about it. However, unfortunately, suicide is a leading cause of death in the United States, but it can be preventable when people feel seen, when they feel supported, and when they have access to the resources and support that they need.
So what are some warning signs, or what are some symptoms that maybe friends and family may notice that we should be, like, red flags?
Absolutely. So the most obvious warning signs are, of course, people talking about wanting to die, people talking about feelings of hopelessness or feeling like they are a burden on others. Some of the less obvious warning signs may be big changes in mood, maybe big changes in energy levels, maybe withdrawing from activities that they once enjoyed, isolating themselves, withdrawing from friends or family, changes in sleep patterns, changes in appetite. Things like that are what we need to be looking for. Also, giving away possessions are things that are warning signs. Do
the statistics show that typically there are warning signs? Because a lot of times we hear tragically from families like, I had no idea that this was something that they were even considering.
Yes. So statistically, there are some warning signs, but like I said, they can be really subtle. And some of these changes in mood patterns and behavior may be really subtle. Like, for example, I work with kids, and this could be like a sudden drop in grades, something as subtle as that, or a sudden, maybe they play football or they're in cheerleading and maybe they just don't feel like going anymore. And, you think maybe they're just not interested anymore, but really it's a withdrawal due to these symptoms and thoughts.
So there's more to it than just lack of interest at this point.
Exactly.
Are there certain groups that, we need to really be focusing on that maybe might be more at risk for this?
Yes. So research shows us that teens and young adults are at a higher risk, that men in their midlife are at a higher risk, that veterans, first responders, and members of the LGBTQ+ community are at a higher risk for suicide. Also, people who are experiencing isolation, who have experienced trauma, or who are experiencing some major life stressors can be at a higher risk as well.
So the big thing then is, what do we do, right? We see these warning symptoms, we see this. How do we respond and how do we help?
Absolutely. So a big common misconception about talking about suicide is that, what if we put the idea in somebody's head? What if we make it worse? Research shows us that this is not the case. Actually, that talking about suicide and asking someone directly if they are thinking about suicide can really be life-changing for them. It can save their lives, and although it is a momentary discomfort for you, it is so worth it in the long run to ask directly if you suspect someone is thinking about suicide, because the statistics and the research shows us that you are not putting the ideas in their head, that you are actually could be saving their life.
Absolutely, and saving the life is what we want to do. And there are resources available beyond us, right? So if we get to a point and they're saying yes or whatever, and we know we need help, what do we do?
Yes, absolutely. So 988 is our national suicide or crisis hotline. So it's a 3-digit number, very similar to 911. You can call or text 988, which is really cool. It is free of charge, and you can call or text 988 24/7. They connect you with immediate support from a trained crisis professional, a crisis counselor. And this is for someone who is having suicidal thoughts, someone who may be in some emotional distress, someone who is having a substance use crisis or any type of mental health crisis can reach out to this number. Also, if somebody that is having, they're having suicidal thoughts and you don't know quite what to do, you can also call or text 988, and this counselor can kind of guide you in the right direction there too.
Very good information. Of course, AltaPointe has resources available as well.
Yes, we do.
And so we're going to put that information for you on our website as well. Hannah, thank you so much for being here. Such an important topic, but oftentimes so very difficult to talk about, as again, we don't want to make it worse or say the wrong thing. So important that we're getting this out here. Today, we're starting to talk about it, right?
Yes, absolutely. Thank you for having me.
Absolutely. Hannah, thank you. Lee, such an important topic.